Hi, I'm Dr. David Hill, and today we're going to talk about how to cure a baby's runny nose. Now, babies may have runny noses for a variety of reasons. The most common is a cold, but babies can also get bacterial sinus infections, they can get allergies, and even gastroesophageal reflux can at least cause some nasal congestion, if not a whole lot of running. How do you tell the difference? Well, a cold usually comes with other viral symptoms like sneezing and cough. Usually the runny nose lasts 7 to 10 days, but no longer than that. It is normal for the mucus to be green, yellow, and thick in the middle of a cold. However, it's not normal to have a fever more than about 3 days in a row, or to have a fever that goes away for 24 hours and then comes back. It's also not normal for the symptoms to last more than about 10 days, except for the cough, which may last as long as 3 weeks. If a baby seems to have a lot of itching of the nose, especially babies over 6 months of age, approaching 12 months, you start to think about allergies, particularly when the symptoms go on longer than 10 days to 2 weeks. If there's a lot of watering eyes and itching eyes, that's also a suggestion of allergies. Finally, if there is prolonged fever or prolonged symptoms, you do have to think about a sinus infection. So, if it's allergies, you want to use an antihistamine. Cetirizine Zyrtec is now approved for babies down to 6 months of age, as is a medication called Clarinex, called desloratadine. Desloratadine is the generic name for that one. For a cold, the baby's going to get over it, but there are some things to make your baby feel better. A humidifier may keep the mucus from drying up and clogging the nose. You can also use Saline Drops in the baby's nose. Now you can go out and buy Saline Drops. Little Noses is a popular brand, but you can also make them at home by taking 1 level half teaspoon of salt and 1 cup of water. Put the salt in the water, heat it up, for example, in the microwave, let it cool down to body temperature, and then dribble 2 or 3 drops using medicine dropper in each side of the baby's nose, each nostril. Then you can go in and suck that stuff out with one of those little suction bulbs that you got when your baby was born. They're usually blue or dark red in color. You can buy them for a couple of dollars at the store if you don't still have the one that you brought home with you from the hospital at birth. This will give your baby relief. Now remember, suck straight back, not up, and you don't have to put the suction bulb way down in the nose. Just a little bit right here at the tip will do just fine. Also, don't overdo it. You can do it too much and kick up more congestion, so just before feeds and before sleep. Talking about curing a baby's runny nose, I'm Dr. David Hill.